Finding patients with chronic disease takes a lot of time. Administratively, it can take quite a lot of time to find all the patients, for example, in your practice with type 2 diabetes. So for those of you that don't code and would like to have patients organized into clinical registers, we had to build a tool to try and help you find patients that may have a certain chronic disease. So this is a run through on these patient finders. Click on reports here on the Socrates system, click into IPCRN tools, and you'll see two examples here of patient finders. So let's click, for example, the type 2 diabetes finder here. What this does is it runs through your entire practice database and it looks for any patient that's already coded with type 2 diabetes. It'll exclude those, and what it'll do then is suggest anybody who may have diabetes. And a patient may have diabetes if, for example, they're on metformin, or if they've got an elevated HbA1c level, or if both in this case here. At the beginning, it'll give you an overview of your number of type 1s and your number of type 2s, but you can see here it suggests that there's 23 patients that may have type 2 diabetes. And if you scroll down, you'll see the reasons why. Some people have elevated HbA1cs, some people are on metformin, and we've included all your typical type 2 medication drugs there. So they'll suggest them. What you can do then is go into your system, find those patients, code them as diabetic if they are indeed type 2 diabetic, and it'll then add them into the clinical register. They won't be shown or displayed here then the next time you run them. Here's another example, type 1 diabetes finder. Again, it'll run through the entire system, and this time anybody on an insulin it'll suggest might be diabetic. So this lady here, this test patient, may have type 1 diabetes. She's on insulin. So that's the diabetes finder. We did pre-diabetes finders as well for people that are kind of borderline diabetic. If you look in cardiovascular here, we expanded it then to include patients that might have heart failure or might have atrial fibrillation. AFib was pretty easy. We just looked at warfarin and some other medications as well and pulled back anybody that wasn't already coded as having atrial fibrillation. Slightly more patients suggested here. 42 are suggested may have atrial fibrillation. It says 23 are already coded, and if you flick through you'll see why. So these patients are on warfarin and dronedarone, very likely to have atrial fibrillation. Others just on warfarin, you never know, they might just be patients with PEs. But I mean, this is a really good starting point to try and find patients that you want to code with a certain chronic disease. So for example, this test patient here, if you thought, yeah, this person really does have atrial fibrillation, you would open their chart, code them as having atrial fibrillation, and then the next time you run this finder, that patient won't be suggested to you again. So that's a quick overview on the patient finders. We've also built them for heart failure. We've built them for the flu finder as well. Hopefully, if you play through the list of tools here we have in the IPCRN section, you'll find them. I hope you find them useful.